The disadvantages, to some extent, is neurologists like to examine patients themselves, and I suppose that's one disadvantage. But these are established patients with ALS that have been here at least one time, and so I feel that with the physician extenders there, PT, OT, RT, ST, I can get all the information I need. We have scale measurements that they take there, which I put in the note, so I can sort of get a sense if the patient's stable or getting worse. You'd think that it would be a disadvantage not to be in the same room with the patient as far as physician-patient connection, but I haven't found that to be the case. I mean, as you can see, we are able to make that good contact just through the iPad. If I had to go to Wichita to see the patients, I couldn't do anything else. I'd knock 2 days out of my week. If they had to come here, that's a huge burden on them. And as you'll see with Chris coming up next, I mean, there's no way he can travel. I mean, Brian still probably could, but it's a hardship. So, I mean, once you've established the diagnosis and they've come up here and we know what we're dealing with, there's no reason why you couldn't do this. And in fact, we could even do this for our local patients as well, in the home. The limitation there is, and we're trying to work this out, like in Hayes and other outreach areas, I would still need my healthcare team to deploy to see the patient, and could I get them to all get to the patient's home? We're actually going to try that in Hayes this year. That's the next step to try to extend this a little further, because we don't have a real focal clinic like they have in Wichita they can go to. I'm here in Kansas City as an ALS specialist, and you live, or you're down in Wichita now. Do you live in Wichita, Brian?
Yes.
Okay, and so we're doing this ALS telemed visit here today, and actually is this the second or third one we've done?
Second.
Second, okay, yeah, because the last one I had was in November, and that would have been our first time we did a telemed. So great. So how you doing? How you doing today?
Yeah, doing well.
Good. That's what I understand. Your legs have always, obviously this started in your arms, and so your legs have always been in much better shape than your arms. Yeah. So what's going on with the arms? Let's get to them. That's really been where this all started in you. And OT, is that you, Denise? That's Denise, right? Okay. Yeah.
Yes.
Go ahead, Brian.
I'm a little weaker in the shoulder.
Okay. All right. Well, it's good seeing you, and we'll see you again. How often are we doing this? You're a slow progressor, so we were doing you 6 months because you're slow progression.
You gonna do 6 months again? Yeah. Okay.
All right. Great. All right. Well, you hang in there and let us know if you need anything.
I will. Thank you.
All right. Bye-bye. I was reviewing your notes from last time that we took, and then talked to the team this morning before you came in, and I want to hear about your new and improved Dynavox. So I hear since last time, not only did we get some mechanical adjustments on the Dynavox, but you got the new software update. So I really want to know how that's working from either of you.
Do you have a miracle shot yet?
A what?
Do you have a miracle shot yet?
Do you have a miracle shot yet?
Oh, the miracle shot. I'm sorry, I didn't. No, but I'm working on it. Yeah, go ahead. We'll get back to research in a minute, which is an important thing. But what about the Dynavox?
It's a miracle. It's wonderful.
Really?
It's totally 100% better than the old one. It's amazing what it does. I think you can talk so much faster.
I'm going to email some of my patients around the country today.
Yeah.
All right. Well, let's get reports from some of the team folks there. Who wants to start?
And then they had a little trouble passing the suction catheter. I think maybe just got a little vigorous with doing it.
Chris says 4, I say 3. I can't remember.
One or the other. Okay. I'm just looking at what we did last time. Is he on any ALS relevant medications? You probably not. Yeah. You want the miracle drug, I know, not Radicava.
Like spread your fingers apart.
That's it.
Yeah. Those are really weak.
So finger abduction looks like it's like a 1 to 2.
Yes.
And finger extension is like a 2 to 3 minus.
Better. Yeah. Yeah, there you go.
Yeah.
Yeah, hold it up so they can see you.
Yeah, and the wrist extension is a 3 minus.
Yeah.